It basically covers anything to do with foot and the ankle, from simple nail, skin type of problems to foot fractures, sports injuries, diabetic foot infections. I've treated gunshot wounds. I've really done a lot of sports injuries, ligament, tendon type of injuries. That's where we focus our practice a lot. Some of the local insurances require, if they've got an HMO or PPO, do require referrals from the primary care physician, but for the most part, no, they can just call us directly. I don't like to have to make people wait for a couple weeks. Most of the time they're hurting when they call us. We don't want them hurting for a long time before they come and see us, so we try to keep people in here pretty quickly. Probably the biggest thing that we're doing is treatment for what's called platelet-rich plasma injections. It is basically using the body's natural healing ability to treat ligament, tendon injuries, muscular injuries, any soft tissue injury to the body, basically. It's the newest thing coming out. We've been doing it for about 8 months now with excellent results. What it entails is we have you come in. We basically draw your blood, intravenously we draw it. It takes about an hour to prep it. There's a special prep that we do where we isolate out the platelets and the plasma from the remaining blood. Prepare that, and then we use that to inject directly into the injured tissue. What that does is the platelets release the body's natural growth factors to stimulate healing response. So a lot of times these tissues can't heal themselves sufficiently following an injury, and this basically stimulates the body's natural healing response to have natural healing occur. The nice thing about it, it's completely safe. It's using the body's own natural properties, and it's pretty pain-free for the most part. We really see two types. We see the acute injury or the traumatic injury where somebody's been running, playing a sport, twist their foot, twist their ankle, something along those lines, where they have an active injury to it. And those respond very well. The other type of injury that we see is what's called an overuse injury or a repetitive trauma injury, where it's just through the course of natural daily activities, at their job, whatever, they stand a lot for work, they walk a lot on hard concrete floors, and they get overuse injuries of the soft tissues, the ligaments, the fascia in the foot, the connective tissue in the foot. That's probably the most common type that we see, is the overuse injury ones. And those can be very difficult to treat because the body just accepts that particular injury as what's natural. And so a lot of times it doesn't try to heal it, and that's where the platelets come into play extremely well, because they're going to now stimulate a good healing response in a non-healing situation. And this is allowing us to keep a lot of these people out of surgery, which is a big thing. It keeps them working, especially in this type of economy right now. A lot of people cannot afford to miss work, cannot afford to have downtime, and this is keeping them out of surgery, more active, return to activities a lot faster than they have been able to in the past. Having had some foot pain myself, as we get a little bit older, unfortunately, we all tend to put on a little bit of weight. We all tend to be a little less active than we were, and then we try to get back in activity. And one of the things that none of us do enough is stretch our foot and our ankle. We just don't do it. The natural daily activities that we do, contracts the foot, the calf musculature, the foot musculature. It contracts those tissues as we stand, as we walk. There is no normal daily activity that we do that stretches the foot and the ankle. And that's where a lot of those overuse injuries come into play, is that the foot gets contracted and tight. So one of the best things I tell my patients they can do for prevention is to stretch the foot and the ankle. It's a very easy stretch to do. You don't need a lot of equipment. You basically need a wall or a step or something where you can bend the foot backwards, not where it's into a pointed position, but where you bend it back up towards the front part of the leg as opposed to pointed towards the calf. Easy to do, doesn't take a lot of time, and will prevent a lot of these overuse injuries that we see.